Hey everyone, Brad Hubbard from the Dallas Plastic Surgery Institute. I'm here today to give a little video on how to use the Cellfina machine and give the general public an idea of how the machine works treating cellulite of the thigh and buttocks. Here's a typical patient that presents to my office for Cellfina treatment. She is a great candidate for Cellfina as she has very defined areas of depression representing connections between her skin and her muscle which are too short. This hail damage type of cellulite is exactly what Cellfina is designed for. When marking the patient, we like to use a completely dark room and a flashlight shining from above, which helps highlight any depression in the skin and show us all the contour abnormalities. We're trying to treat each spot individually, and so each one is marked exactly to the depth and size of it. Many patients wish areas in the inner thigh, especially around the knee, to be treated, but this is not cellulite, and it's not something that Cellfina can reliably fix. Here's the patient after markings have been complete, and what I'm thinking when I look at this drawing is which direction I'm going to be treating from, and which depth I'm going to be treating at, either 6 millimeters or 10 millimeters. On the thigh, you must be treating vertically, either from above or below. In the buttocks, it does not matter as much, and you can treat in the area of most logical orientation. This is the numbing procedure. You see a long needle with multiple holes along its length. It's completely inserted, and 8 cc's of numbing medication is placed, as well as some epinephrine to prevent bruising and bleeding during the procedure. The numbing procedure is very well tolerated by our patients, and we have not treated anyone before the procedure with Valium or pain medications. The numbing procedure takes about 30 to 40 minutes, depending on the patient and how many areas wish to be treated. We found that the anterior thigh is more painful than the lateral, posterior, or buttocks. When injecting the numbing medication, it's important to remember which direction you're going to do the release from, and add a little bit more numbing medication in that area. This is the device which causes the release. It's a double-sided blade, which is 2 millimeters wide, and you want to center the area of release in the first square, which looks like a baseball diamond. The blade passes through a small hole in the skin, which does not need to be repaired, and the machine is swung back and forth as it reciprocates, completely severing any connections between the skin and muscle in that area. You'll notice a suction cup device, which is the clear plastic circle. It can be flipped over to release at either a 6 millimeter depth or a 10 millimeter depth. There are multiple reasons to switch, but the most common is if you have two areas which are directly adjacent to each other, and you would not want to create a continuous release under the skin. I've demonstrated this here, how quickly and easy it is to flip over and switch to a deeper depth to prevent a continuous release. The fear with a continuous release is that there wouldn't be enough connections between the skin and muscle, and this area would look swollen or puffy as it is not as well adherent as the surrounding skin is. This is the typical results of our patients who have been universally happy in the range of 90-95% satisfaction rate. If you'd like some more detailed information on Cellfina or some more before and after pictures, please visit my website.